Hello everyone, welcome to the video class on GPAT Strategies for Pharmacology. The exam is getting very close, so all the best for all the GPAT aspirants. So do well in your exam, follow the strategies, you will definitely do well. Now in this video lecture, I am going to explain the types of questions which are frequently being tested in pharmacology, like not true or not correct questions, mechanism based questions, adverse effects based questions, kinetics oriented questions, and physiology link based questions. Let us begin. Let us see with previous question examples. Now see this type of question, which of the following is not true or not correct. Now see, in GPAT we have 4 options are there, and one of the question type is you need to find out which one is not true. That means out of 4, 3 are correct. So you need to have a thorough understanding to answer this question correctly. Only one is wrong, the other 3 are right. Let us see how the questions are. See, the following is not true for furosemide. This question is asked in 2018. Now, out of the 4, 3 are correct, only one is wrong. So such kind of questions will test your in-depth knowledge of mechanism of action and effects of these drugs. So that is what is the logic behind these not true questions. We need to have a thorough understanding of the topics. Let us see the options. See, the first option is it causes hypokalemia. Now before getting into that, let us understand what this furosemide does. It is a loop diuretic and it inhibits sodium, potassium and 2-chloride symporter. When it is inhibited, all these ions will be passing through the urine, and along with that water goes out and it causes profuse diuresis. So that is the reason why loop diuretics are also known as high ceiling diuretics. Now this is the mechanism of action, but you need to know all the effects of furosemide. Now see, because it is losing potassium, it causes hypokalemia. True. Now see, loop diuretics also causes hypomagnesia. How? See, when sodium, potassium are lost from our body, what it happens is, see, there occurs a potential differences in nephron. The job of this importer is to retain back sodium and potassium. But when they are losing out, body is losing these positive potentials. Along with that, calcium, magnesium also is lost from the body. So loop diuretics not only cause hypokalemia, they also cause hypomagnesemia and hypocalcemia. So both of them are also the effects of furosemide. Now see, inhibits sodium reabsorption. You can clearly see it can inhibit sodium reabsorption. Causes hypouricemia. No. Furosemide in fact increases uric acid levels in the body and it causes hyperuricemia, not hypouricemia. Now in order to answer such kind of questions, think about the mechanism of action of this furosemide. Now think about the mechanism of action of furosemide. As I told you, it causes sodium, potassium, 2-chloride pump inhibition. So when you know the simple mechanism of action, you know this one is true for it, this one is true for it. Now because of these things, it also causes sodium and calcium, magnesium loss. So this one is also included in mechanism. So only the wrong one is this one. What happens is, from the proximal convoluted tube, both the loop diuretics and uric acid, when you see the nephron, from this proximal convoluted tubule, both loop diuretics and uric acid, both of them will get absorbed from the same pathway. So when there is a competition, uric acid remains inside and these loop diuretics will get into nephron. So it is increasing the concentration of uric acid, hence it causes hyperuricemic action. So you need to have a thorough understanding, then only you could answer this type of questions. Let us see one more example. See again, which of the following is not correct for myasthenia gravis? Now see, for anything I have explained in my previous video also, you need to understand these words. When you understand that words, you will understand the condition. Maya, what do you mean by Maya? Maya means muscle. Asthenia means weakness. Now gravis means a serious condition. So what do you mean by myasthenia gravis? A serious muscle weakness condition. Simply put, a serious muscle weakness condition is myasthenia gravis. And why it is happening? Myasthenia gravis is a kind of autoimmune disorder. Autoimmune disorder means our own immune cells will start attacking nicotinic receptors. When nicotinic receptor levels goes down, acetylcholine cannot act on the receptors and muscle contraction is impaired. That is why it is called as myasthenia. Muscle weakness is there. So this is brief things about myasthenia gravis. You need to understand couple of things. One, it is an autoimmune disorder. Second one, nicotinic receptors will get affected. Third one, muscle contraction is decreased or muscle weakness will be there. Now let us see which one is not true with myasthenia gravis. Down regulation of nicotinic receptors leads to myasthenia gravis. True. This is what happens. Tuberculin is used to treat myasthenia gravis. No. What is the action of tuberculin? It is a skeletal muscle relaxant. It reduces muscle contractions. The disease is causing decreased muscle contraction. Again, you give such kind of drug, what happens? Severity of the disease increases. So this is not correct. The other one, it is an autoimmune disorder. True. This is what we have seen. It is an autoimmune disorder. Next one, thymectomy is a treatment for myasthenia gravis. What is thymus gland? From that you have immune mediators releases. What happens in myasthenia gravis? It is an autoimmune disorder. When immunity is increased, when immunity is directed towards nicotinic receptors, myasthenia gravis results. So this is the one of the course of treatment to treat myasthenia gravis. Now understand how the questions are being tested. 3 will be correct, only 1 is wrong, and you need to find out what is the wrong one is. This is given in GPAT 2018. We'll see one more example. Which of the following is not the role of nitric oxide? This is tested in GPAT 2019. Again, not the role, not correct, not true, not the role. Mediates microbicidal action of macrophages. Yes, nitric acid is found to show this action. It serves as a neurotransmitter in CNS. Yes, researchers wondered how a gas can act as a neurotransmitter, but it acts as a neurotransmitter. Induces platelet aggregation. No, in fact it inhibits platelet aggregation. It causes smooth muscle relaxation or vasodilation. True. In fact, it was known as endothelium derived relaxing factors. Previously, nitric oxide was known as endothelium derived relaxing factor. It causes smooth muscle relaxation and inhibits platelet aggregation. So what is not true here? Not true. Inducing platelet aggregation. You need to understand this type of questions. All the 3 will be correct. To know that, you need to know all the rules of that particular chemical or drug. So here the answer is, this is not the role of nitric oxide. Moving further, the next one, the last one in this category, one of the following statement of carbachol is not correct. Now see, carbachol is a acetylcholine derivative, synthetic derivative. See, acetylcholine, the duration of action is very less. To increase the duration of action, structurally it is changed and created methacholine. Methacholine is a methyl derivative of acetylcholine. Even the duration of action is not enough, so it is again converted to carbachol. Now, the reason why carbachol is produced is to increase the duration of action. How you can increase the duration of action? By reducing its metabolism. Now this is about carbachol. Now let us see the options. See, it can be administered orally. True, because you have increased duration of action. It possesses both muscarinic and nicotinic action. Similar to acetylcholine, it has got more muscarinic as well as nicotinic action. True. It is more susceptible to hydrolysis as compared to acetylcholine. No, it is better. It is resistant to the hydrolysis. That is the reason why carbachol is prepared. This is not correct. Now the next one, the amino group decreases electrophilicity of carbonyl group. Now this is an interesting feature. Let us understand what is happening. See, in carbachol you have these groups are there. Yeah, this is what is the major group in carbachol, and amine is there. Now what happens is, how the hydrolysis will get affected is, the oxygen is more electronegative and carbon will have a kind of partial positive charge. That means carbon is more electrophilic. If it is more electrophilic, the ester breakdown becomes easier and easily it will get hydrolyzed. Let me repeat this. In carbonyls, oxygen is more electronegative, hence the electrons are pulled towards oxygen and carbon gets a positive charge. If carbon gets a positive charge, it is becoming electrophile. Because it is a positive charge, it likes negative charge. Electrons has got a negative charge, hence it is known as electrophile. Now, if you attach an amine group, what is happening here? Amine has got lone pair of electrons. These electrons are transferred here to neutralize this charge. So what is happening? This amine is reducing electrophilicity. Look at this. The amine group decreases electrophilicity of the carbonyl group. Exactly true. This is how they will increase the duration of action. When the electrophilicity is reduced, the susceptibility for hydrolysis is reduced, so it becomes a longer T-half will be increased, longer duration acting drug it will become. So what is wrong here? The wrong one is, no, it is not more susceptible, it is less susceptible when compared to acetylcholine. So this is not true. So not true questions are frequently tested. You need to think logically and then answer it. Moving further, the next strategy is mechanism of action. See, when you read mechanism of actions, there are two types are there: physiological effects, biochemical effects. Let us understand them. Imagine paracetamol. When someone asks what is the action of paracetamol, we say it is used to treat fever, body pains, and inflammation. So this is called physiological effect. So what it does, it reduces fever. What is the effect? It is physiological effect. Now, but how it does? By inhibiting cyclooxygenase. What is this effect? This is called as biochemical effect. Biochemically, what is happening? Cyclooxygenase enzyme is inhibited. Physiologically, what is happening? Because of that, fever is getting reduced. So whenever you read mechanism of action, you need to think like this. What is the physiological effect? What is the biochemical effect? Some of the questions are tested based on the physiological effect. Some of the questions are tested based on biochemical effect. Let us analyze them. Now this is tested in 2018. Which of the following are the mechanism of action of digitalis glycosides? Now see, all of them are biochemical actions and you need to understand thoroughly. What is the physiological effect? Digitalis is a cardiotonic. Cardiotonic, that means it increases cardiac output. That is the physiological action. But what is biochemical action? It acts by inhibiting sodium-potassium pump. So when the sodium-potassium pump is inhibited, sodium levels inside the cardiac cell increases. That also increases the levels of calcium. When calcium is increased, cardiac contraction increases. This is the direct action. But along with that, the digitalis has got an indirect action. It activates parasympathetic nervous system. When parasympathetic nervous system is activated, heart rate is reduced. See, direct action increases cardiac contraction. This is positive inotropic effect. Whereas indirect action, heart rate decreases. This is negative chronotropic effect. So heart rate is reduced. So this is what is the mechanism of action of digitalis. Now let us see the options. Inhibition of sodium potassium ATP enzyme. See, which of the following mechanism of action of digitalis glycoside? See, there is a combination of options are given. Again, it is a multiple actions are there, because of that combination is given. Yes, it inhibits sodium potassium pump. Reduction of atrioventricular conduction. Atrium is also known as auricle. So this is what happens with negative chronotropy. When parasympathetic system is activated, heart rate is reduced, and how it happens? By reducing auriculoventricular conduction rate. This is true. Increases cardiac output. This is the physiological action of digitalis. Now acceleration of atrioventricular conduction rate. No, this is not true. See, there is a difference. This is reduction, this is acceleration. If reduction is true, acceleration will not be true. So now look at the option combinations. You have all kind of options. See, these two are biochemical actions, whereas this one is physiological action. You need to know all the actions, then you could answer this. So 1, 2, 3 are correct, but this one is wrong. So what is the option? 1, 2, 3. So this is how you need to answer. Moving to the next one. See, the mechanism of action of ciprofloxacin is inhibition of. This is given in GPAT 2018. Again, they are testing your biochemical mechanism of action. Ciprofloxacin is DNA synthesis inhibitor. It is not a protein synthesis inhibitor or cell wall synthesis inhibitor. It is a directly classification based question. You know, you have ampicillin, tetracyclines, chloramphenicol, all of them are protein synthesis inhibitors, whereas penicillins kind of beta-lactam antibiotics are cell wall inhibitors, whereas ciprofloxacin, quinolones and fluoroquinolones, they inhibit DNA. So again, this is mechanism based question. Moving to the next one. Select the ulcer protective drug from the following. See, physiological action. This is just asking what is the physiological action. Sucralfate is a ulcer protective drug. Metronidazole is an antibiotic. Misoprostol is also See, this will reduce the acid secretion. This is also used to treat ulcer, but this is reduce acid secretion. Oxyphenonium is used to treat spasms. So which one is ulcer protective drug? Sucralfate. So this question is based on physiological effect of the drug. The previous questions are based on biochemical effects of the drug. This is tested in GPAT 2019. Moving to the next one. So the next strategy is about adverse effects. Again, you have different kinds of adverse effects are there. One of the major adverse effect is mechanism based adverse effect. Let me explain this. What do you mean by mechanism based adverse effect is? See, take the case of antihypertensives. All antihypertensive agents will reduce blood pressure. What is the normal blood pressure? 120 by 80. When hypertensive patients take antihypertensives, will that blood pressure exactly comes to 120 by 80? No, there is always a chance to going down. If anything more than 140 by 90 is hypertension, anything less than 120 by 80 is hypotension. So most of the, all of the antihypertensive drugs will cause, one of the side effect is hypotension. Why it is causing? Because of its mechanism of action. Its action is to reduce BP and it may result in hypotension. So this kind of adverse effects are known as mechanism based. The other adverse effects are not related to mechanism of action. So see, when you read about adverse effects, mechanism based will be very easier to understand, because when you know the mechanism, you will get these adverse effects. But we need to memorize mechanism not related adverse effects. We'll see them. Now see, which of the following side effect of ACE inhibitor result from inhibition of bradykinin breakdown? This is given in GPAT 2018. Now see, ACE inhibitors, angiotensin converting enzyme inhibitors, will inhibit angiotensin converting enzyme, as well as bradykinin breakdown is also inhibited. Bradykinin has got a lot of responses. It causes vasodilation, it causes dry cough. So when bradykinin levels are, metabolism is reduced, bradykinin levels increases and it causes dry cough. Now see, what are the other options? Analgesia, no, it will not cause analgesia. Hyperglycemia, no. Productive cough, see, there is a difference between dry cough and productive cough. Productive cough is also known as wet cough. Wet cough means when people cough, they will get phlegm along with that, or sputum from the respiratory tract, whereas dry cough without any wetness or without any sputum will be there. And this dry cough is the major adverse effect due to the increased levels of bradykinin. Now see, this adverse effect is related to mechanism. What is the mechanism of action? ACE inhibitors will inhibit ACE enzyme as well as bradykinin metabolism. So you will get all the effects due to increased levels of bradykinin. So it is a mechanism based adverse effects. Answering these kind of questions, you need to understand the mechanism, then you will get the answer. So the answer is, the side effect is dry cough. Going to the next one. See, excessive use of diuretics can lead to. Now what is the function of diuretic? Diuretics will cause excessive urination. If you are using excessive diuretics, what happens? Fluid loss will be there. When fluid loss is there, what happens to fluid volume? It goes to a condition called as hypovolemia. Emia means blood, hypovolume means reduced in volume. So blood volume reduces. If blood volume is reduced, that immediately may cause a shock. That is called as hypovolemic shock. So again, this is exactly mechanism based adverse effect. When you use too much of diuretics, fluid loss will be there, that will result in hypovolemic shock. So this is the answer. Again the adverse effect is based on mechanism. Second one, the other one. The adverse effect of beta 2 agonist does not include. See, it belongs to both the categories, does not, true or false, as well as adverse effect 1. Now what happens is, beta 2 agonist will cause bronchodilation. In fact, how it causes bronchodilation? By causing smooth muscle relaxation. So when smooth muscle relaxation occurs, vasodilation may occur. When vasodilation is there, what happens to BP? BP may fall down. To correct this, a slight increase of tachycardia and a tremor will be there. Tremor means shivering. Excuse me. So these are all the effects of beta 2 agonist and other effects. So now understand the options. See, the major effect is peripheral vasodilation. This may result in tachycardia as well as fine tremor. So all these are kind of adverse effects of beta 2 agonist. But which one is not the effect? Hypertension. In fact, it is causing decrease in BP, hypotension it causes. To correct that is mild tachycardia and fine tremor will occur. So this is the option. So again, see, adverse effects, when you understand properly the mechanism, writing adverse effects will become very easier. You need to learn like this. Next one, kinetics oriented question. See, kinetics, absorption, distribution, metabolism, elimination. There are questions based on this thing linked with mechanism of action. Let us see the examples. See, which of the following is the shortest acting cholinesterase inhibitor? So they are testing which of the following has got low T-half. See, edrophonium has got shortest duration of action. It will be acting hardly for 10 to 20 minutes. Remaining all will be acting till hours together. This is because of its short duration of action, it is sometimes used to treat arrhythmia, as well as it is also used to diagnose myasthenia gravis. So the duration of action is based on kinetics, and this is a kinetic based question. So while reading the classification, you need to make a note of such kind of drugs. So the option is edrophonium. Moving to the next one. Now see, which of the following combination of drugs are used in treating severe traveler's diarrhea? I'll tell you what is the relationship with kinetics, but first observe the options. Pyrimethamine sulfadiazine is used to treat malaria. It is an anti-malarial drug. Trimethoprim sulfadiazine. See, again, sulfadiazine is used to treat burns. Trimethoprim, this combination will not work. It is not a proper combination. Pyrimethamine sulfamethoxyl, again, this is not a proper combination. Pyrimethamine sulfamethoxyl, yes, this is a combination. This is known as cotrimoxazole. Trimethoprim methoxazole, trimethoxazole combination. Why this combination is used is both of them has got kinetic profiles, kind of similar kinetic profiles. Because of their pharmacokinetic similarity, this combination is used, and this is the effective drug to treat traveler's diarrhea. So all other combinations, they don't work. In fact, see, this is this is not used to treat malaria. In fact, sulfadoxine is used. Sulfadoxine. Now understand why only specific combinations are used, because of their similarity in kinetic profiles. Again, why trimethoprim and sulfamethoxyl are used? See, both of them, the T-half is 10 and 11 hours. So very similar kinetic profiles are there. Because of that, they are used. They are used in the combination of 1:5 doses. So the option is this one, trimethoprim and sulfamethoxyl. So again, this is based on kinetics. Because of the similar kinetics, the combination is used, and you need to know the logic why this combination is working. Moving to the next one. Physiology linked questions are there. See, you cannot separate pathology, physiology and pharmacology. All of them are interlinked. Let us see how it is. See, the enzyme HMG-CoA reductase is involved in the pathogenesis of, this is stated in 2018. What is this class? All the statins. What is the use of statins? They are lipid lowering drugs. When lipids are lowered, they can be used to treat which disease? Atherosclerosis. Pathophysiology related question. They are not asking about mechanism of action. They are asking the link between the drug class and the disease. So these are called as physiology and pathology related questions. Another type of question. To obtain more effective bronchodilation, the drugs that are combined along with beta adrenoreceptor agonist. What happens? Bronchodilation, beta to adrenoreceptor agonist. So with which class you can combine with this? See, the question is based on the physiological effects of the drugs. Now, cholinergic antagonist. What are the responses of cholinergic system? Increasing secretion. Increasing secretion is one of the effects of cholinergic responses. So when you block that, secretions are reduced. That means bronchial secretions are reduced. So to treat asthma kind of diseases, you need bronchodilation, and bronchial secretion should be reduced. So bronchodilators can be used along with cholinergic antagonists. When you understand the physiological effects of cholinergic antagonists, then we can use it. Atropine is one of the choice of drug to reduce bronchial secretions. So the option is this one. This you can combine with bronchodilating drugs. Moving to the next one. Cardiac output is again straight away physiology question. See, cardiac output is the amount of blood coming out of the heart, the amount of blood which is coming to the systemic circulation. So systemic circulation means it should get into aorta. To aorta means, see, heart has got these chambers. To the aorta, from left ventricle, blood will goes to aorta. So the amount of blood going to this aorta per minute is known as cardiac output, a direct physiology part. Look at this volume of blood ejected by the left ventricle per minute. This is what is cardiac output is. All other thing, it is not per beat, it is not per beat, it is not by auricle, it is only by left ventricle. So you need to understand physiology and pathology to do well in this kind of questions. So this is tested in GPAT 2019. So some of the strategies I have explained. All the best for your exam. Thank you for watching this video.